Hi, my name is Jeff. I'm 26 years old and I'm from Indiana, and I'm having double jaw surgery on October 29th, and I'm really excited about it. Um, I'm having jaw surgery because of my underbite, and I'll go ahead and show you guys my bite. This is where my bite's at right now. As you can see, it's pretty open all the way around in the front. And I've had an underbite at least since I was 13. When I was 13, that was when I went to the orthodontist for the first time, and that was when they told me that I had the underbite, and that as I got older, when I was 18, I would need to get braces again and have jaw surgery at that time. And I was going to get the braces back on. I probably would have had the jaw surgery when I was 19, but things kind of fell through with the insurance, and I kind of decided at that time that I just didn't really want it then. So I just sort of put it off, and then in 2011, I was just kind of thinking about braces again and wanted to get my teeth fixed, and I came across videos on YouTube, and I just was so inspired by the journey that everybody went through. It was just really inspirational to see the positive changes and impacts that it made in their lives, and it just kind of gave me the courage to pursue this myself. And yeah, I'm really excited about it. So I'm 26 now, and it's been a few years, and I'm so ready for it to happen. Let's see. So I guess I got my braces on in August of 2011. So I've had my braces on for 14 months now. And it's crazy for me now that it's actually surgery time. It seems like I've been waiting forever, and now it's finally going to happen. As far as the specifics go with my surgery, they're going to make an incision on my lower jaw on each side, and they're going to take a piece of bone out there. It's probably just a teeny tiny sliver, and they're going to push my lower jaw back, and then on my upper jaw they're going to make a cut all the way across the front of the bone, and then they're also going to make cuts down here and down here, and essentially they're going to cut my upper jaw into 3 separate pieces. And then with those 3 pieces, they're going to move it up and forward. And I guess the reason why they needed to cut it into 3 pieces was that they couldn't get my bite to match up perfectly if they just moved the whole upper jaw as one segment. So yeah, this is the better option than for them to do it separately. And since they are doing the 3-piece split on my upper jaw, I will have to wear a surgical splint on my top teeth for 4 weeks, and honestly that's probably one of the things I'm looking forward to the least, because just from what I've seen from other people on YouTube, it seems like the splints, they make it really hard for them to communicate, and food gets stuck in there, and it's hard to keep your teeth clean. And so I'm definitely not looking forward to the splint, but I mean, if I have to have it, I have to have it, and I'll get through it, and hopefully 4 weeks will fly by and it won't be too big of a deal. Let's see. Preliminarily, they told me that he was going to move my lower jaw back 3 millimeters, and he was going to move my upper jaw forward 4 millimeters. So, but I don't know if that's like specifics or if he's going to have to change his mind later, but that was what he told me about a month ago. Let's see. I guess the reasons to have the surgery would be definitely increased functionality. I mean, if you look at my bite right now, since I'm open all the way across in the front, it makes it really hard to eat. Basically, when I eat, I have to cut everything up, and the only teeth that I really use to chew food are the very back teeth, because that's the only place where I actually have contact between my upper and lower jaws. A little bit, the tips on the sides of those teeth touch a little bit, but overall, definitely, it just causes a lot of wear and tear to those teeth, and it's definitely something I want to get taken care of so that I can keep healthier teeth over the course of my lifetime. And I also think it'll help with my speech a little bit as well. So I mean, those are just the big things. I mean, it's definitely a surgery for functionality. I really can't wait to have my bite back to where it's supposed to be. I think a lot of people take for granted the fact that their bites are correct. They might not understand why I'm having this surgery, maybe just because, I don't know, if some of us just aren't born that way, and we don't have that bite that we were born with, that stayed with us as we grew. So this is something I want to get taken care of, and I definitely want to increase the functionality of my bite and have the perfect smile in the end. Let's see. Specifics on my surgery: it is a 4-hour surgery, and it's going to be in Indianapolis. Let's see. My surgeon, he's a really experienced surgeon. He's done like over 2,000 jaw surgeries in the past. He did my orthodontist jaw surgery. He did my cousin's jaw surgery, I believe, back in the 80s. So this is like no big deal to him. I've heard that him going into jaw surgery is just like any other day in the office. So that's good. That's what I want to hear. I want somebody who is going to be able to just go in there and get it done, and no big deal. So I definitely feel like I'm in good hands, and I'm happy and thankful for that. Let's see. Tomorrow I am getting my surgical hooks put on at the orthodontist. They're going to put those hooks on so that they can use those for the rubber bands after the surgery to keep me closed. And then they're also going to take molds tomorrow with the orthodontist in order for the surgeon to make my splint. So I guess overall, yeah, that's kind of what's coming up for me. I can't really decide if I'm nervous or if I'm excited. It's kind of a mix of both. I think I'll be more nervous the closer I get to surgery. I don't know if I'm more nervous for the surgery itself and being under anesthesia, or if I'm just nervous for the recovery, because it seems like the recovery varies so much from person to person. So I'm just hoping for the best and hoping it's a good recovery. So yeah, that's kind of all I have for now. I'll probably update again before surgery once I have my hooks on, so check back again later. Thanks, bye.